Good morning, everyone. I am Dr. Luinio S Tongson, Vice President of Diabetic Food International from the Philippines. I want to start by thanking you for taking time out of your busy schedules. Today, we're going to talk about something that literally carries us through our workdays but often gets overlooked: our feet. For those of us managing diabetes, our feet deserve special attention. The strategies we're going to discuss are designed specifically for busy professionals like you. This isn't about adding more to your plate, but about smart, efficient habits that can protect your mobility and future. And why feet need special attention in diabetes. Consistently high blood sugar affects two critical systems. First, nerve damage. Imagine wear thick gloves on your hands all day. You're going to lose fine sensation. That's what neuropathy does to your feet. You might not feel a pebble in your shoe or a developing blister. Second, poor circulation means that when you do get a minor injury, your body struggles to deliver the healing resources it needs. Together, this creates a situation where small issues can rapidly become serious problems. Now let's talk about the perfect storm of busy work life. How many of you have ever thought, I'll deal with this later? When we're rushing between meetings, working long hours, and dealing with stress, foot care often falls to the bottom of your priority. But here's the catch. That's exactly when problem can start. Tight shoes during a long day, skipping foot checks because you're exhausted, stress raising your blood sugar. These are the moments when vigilance matter most. The good news is that with awareness and simple habits, we can avoid these traps. This is your most powerful defense, and it takes less time than checking your morning emails. The daily food checks should become as automatic as brushing your teeth. The ideal time is after your shower or before bed. First, do the soul search. Use a mirror if you can't easily see your soles. Second, actively look for changes: new red spots, blisters, cuts. Third, feel for warm areas with the back of your hand. Warm often signal inflammation starting. This 2-minute routine is your early warning system, catching problem when they are small and when they're still small and manageable. Let's get specific about what we're looking for. Pay special attention to high risk area between your toes, your heel, the balls of your feet. Look for any break in the skin. Even a tiny crack between toes can become problematic. Notice color changes. Unusual paleness or blueness suggests circulation issues. Feel for temperature variations. Localized warmth often means inflammation or early infection. Cold feet might indicate poor blood flow. And don't ignore dry, cracked skin. Think of these as potential doorways for infection. Being a good detective with your own feet is a skill that pays lifelong dividends. Your shoes are like a helmet for your feet. They're your first line of defense. Choose shoes with a deep toe box so your toes aren't cramped. Good arch support for all-day comfort, and a firm sole that protects you from uneven surfaces. Your socks matter too. Moisture-wicking fabrics keep feet dry and prevents friction. But here's the non-negotiable rule. Never walk barefoot. Not at home, not at the beach, not in the hotel rooms. That unseen piece of glass, that hot pavement, that stray thumbtacks, They all pose real risks. Indoor shoes or slipper are a must. Here's a practical tool for busy professional. Your foot care survival kit. Isn't complicated or expensive. A small bag with moisturizer for dry skin. Remember, apply everywhere except between toes where moisture can cause problems. Include a nail file for smoothing rough edges safely. And keep spare socks. If your feet get sweaty during the day, changing socks can prevent blisters. A hand mirror makes the sole search easy. And most importantly, antiseptic wipes and bandages for immediate first aid if you find a small problem. This kit is about being proactive rather than reactive in your foot health. Let's integrate foot care into your workday seamlessly. If you have a desk, keep a spare pair of comfortable shoes there. Changing shoes midday gives your feet a break and prevents pressure points. If you're a desk bound, set a reminder to do a simple exercise every hour. We're going to show you some in the next slide. If you keep your if your job keeps you on your feet, take every opportunity to sit and elevate your feet briefly. When traveling, don't break your routine. Your daily foot check is just as important in a hotel room. These small adjustments require minimal time but offer maximal protection of your feet. Practice these simple habits. Move and protect. For movement, set a timer to stand, stretch, and walk for 2 to 3 minutes every 60 to 90 minutes to improve circulation. Simple desk exercise help blood flow without disrupting work. For hygiene, wash feet daily with warm, not hot, water and mild soap. Avoid soaking feet for long period. Pat dry thoroughly, particularly between toes, and apply a thin layer of moisturizer to the tops and sole. Avoid applying lotion between the toes to prevent excess moisture. For nail care, trim nails straight across and file edges smoothly. If you have thick, ingrown, and fungal nails, see a podiatrist rather than attempting aggressive self-trimming. For managing minor wounds, for small cuts or blister, clean with mild soap and water. Apply an antiseptic and cover with a sterile dressing. Check the dressing daily and change it if it becomes wet or dirty. Here's your desk exercise routine. Simple exercises that boost circulation without leaving your chair. First, ankle circles. Lift your feet and make circles in both directions. Second, point your toes like a ballerina, then pull them back toward your shin. Third, do heel raises while sitting. And for home, try picking up marbles with your toes. It strengthens foot muscles wonderfully. These exercises take just minutes, but they're like giving your circulation a coffee break. They prevent stiffness and keep blood flowing to those hard-working feet. This might be the most important slide. With diabetic foot care, wait and see is never the right approach. If you notice any of these warning signs, it's time to call your doctor. A small cut that isn't healing, persistent redness or warmth, any color changes, or unexplained pain, these are all signals from your body that something needs attention. Don't try to treat serious foot problems yourself with over-the-counter medication. Early professional intervention can prevent minor issues from becoming major complications. You are the expert of your own feet. Trust your observation. Let me show you visually why early action matter. Here in stage 1, we see a simple blister without normal sensation. You might not feel this. Without proper treatment, there is a risk of infection. Effective management might include cleaning the wound, relieving the pressure from the affected area, and applying appropriate dressing to prevent further deterioration and promote healing. In just a day or two, if not properly managed, it can progress to stage 2. The blister opens and becomes infected. Without proper care and good circulation, this can rapidly go to stage 3 or grade 3. Without proper and timely treatment, the ulcer might process to necrosis, where surrounding tissues start to die. This progression can happen in days, not weeks. But here's the hopeful part. Catching it at stage 1 during your daily food checks means simple intervention can stop this progression completely. Your daily check is your power to prevent serious problems. Many people feel anxious about calling their doctor. Here's a simple script to make it easier. Start by identifying yourself and the reason, like, "Hello, I am diabetic patient with a food concern." Then, report the facts clearly. "I have a blister on my heel that I noticed this morning. It's about the size of a pencil eraser, and the skin around it is red and warm." And finally, state your concern. "I'm worried because of my diabetes." This gives the medical staff exactly the information they need. Remember, they want to hear from you early. It makes their job easier and your outcome better. You are the most important member of your food care team, but you're not alone. Your healthcare providers are your partners. Make that yearly comprehensive food exam as a routine as your dental cleaning. During these visits, your doctor will check sensation with a simple filament and assess circulation, catching changes you might not notice. Come prepared with a question. No concern is too small. Many people benefit from working with both primary care doctor and a podiatrist. Remember, asking for help isn't a sign of weakness. It's a sign of taking control of your health. Let's recap your simple but powerful action plan. First, make the daily 2-minute food check non-negotiable. Second, always choose protective footwear. Third, never walk barefoot anywhere. Fourth, call your doctor at the first sign of trouble. And fifth, partner with your healthcare team for regular checkup. These 5 habits form a complete strategy that protect your feet without overwhelming your busy schedule. They preserve your mobility, your independence, and your ability to stay active in the life you built. Thank you for your time and attention today. Remember, your feet carry you through your busy work days and enable you to enjoy life beyond work. They are truly worth every step of care and attention we have discussed. Thank you for your investing this time in your health and your future. Mabuhay!